Hello. Today my guest is Christopher Berger. He is a pulmonologist, so specialized in the respiratory system, and he is one of the doctors who contracted COVID during his treatment of patients. So, yay, Malia's here. Okay. And Chris just, okay. So we'll just pin this comment and then we'll get to the conversation. Hi, Chris.
Hey, Marg, how are you?
Good. I feel like whenever I talk to you, it's usually under such less austere conditions.
Yeah, that's probably true. Well, especially this 2020.
It's been crazy. So, um, even before everything happened this week with all the intensity around race, it seemed like a good idea to talk to you. And it still does because you have this amazing, crazy perspective of contracting corona while the Bay Area was being infected by it. And you were a health worker and still are. So I thought it's good to just tell that story and start from there. And if we end up getting to the modern day, that's good too. But let's go back into where that started for you.
Yeah, I got diagnosed in mid-March. So I was like, I think at that time there were only 53 confirmed cases in the city.
Wow.
So it's very early in the story, at least in the Bay Area. Um, yeah, it was a very, in looking back, like for the first 3 days, I just had what I thought were allergy symptoms because I have really bad allergies. So I got like a runny nose, a sore throat. Um, and I was like, wow, that's sort of interesting. Spring is coming. I also developed a toe, the Coveted toe that
Like
people have been.
numbness.
Sorry?
Like numbness.
No, it turned purple. And I thought I had just stubbed it and forgotten and broke my toe because it's pretty common to, cause little small breaks in your toes accidentally. It's not that hard. And so I sort of just figured I had broken a toe. But in retrospect, that was definitely one of the first signs. Now we realize like that's related to the blood clot risk that people have. They develop these little micro clots in their toes, and that's why they turn purple. And
So it
then,
looked like, how did your toe look? Like Malia's asking my cousin who knows you, was it your big toe?
no, it was my fourth toe,
Okay.
just one out of all 10, the one right next to my pinky toe.
And how did it look like just a bruise? Like it looked no different than if you had stubbed your toe?
Well, it was sort of entirely purple, like the whole toe all around. So it
Oh,
wasn't like
wow.
you just hit one part of it.
Yeah.
Um, but if anyone has ever broken a toe or a finger, like that's what happens. Like they just turn all, you know, and with your toes, you can't really do anything about it. You just, you know, tape it to the one next to it, and then just try to, give it some time to heal. So I thought I'd just broken it, but
Yeah.
turns out it was probably the very beginning.
So you had like, did the sickness to you feel different than a sort of standard cold flu?
It was like, unfortunately, I've had the flu several times, also probably contracted from work. The last time was 2 years ago. And the way I described it to people was it's like your worst day of flu, of influenza specifically, but goes on for like 10 days. And for me, the biggest thing was fatigue. Like, I'm usually pretty active and busy all day long. And, I'd wake up and I'd try to do a little work at my computer, and then I'd fall asleep for 3 hours, and then I'd fall asleep at 6 p.m. Like it was just like really tough. And that was especially at the beginning when I had a lot of fever. I just had constant fevers, and so was taking a lot of meds to help with it. And at that time, it was also just wrapped into a lot of anxiety, as you could imagine, because you just have
Yeah.
no idea. I mean, there's also this, you know, people now, as studies have come back, we know that when people get hospitalized, it's really like after day 7, like day 7 to day 12 is when they get the really bad respiratory symptoms oftentimes. So sort of also knowing that, you're just like sitting at home waiting to see if you're going to get to that
Great.
spot or not,
Yeah.
or if
Did
you're
you
going to be okay.
find, like after 7 days, did you find that your symptoms were intensifying at all?
My fever went away, but then I developed a little bit of a cough. It wasn't that bad. And the thing that bothered me the most was, like, if anyone's ever been in really cold weather where it's like -0 or more, or 0 or negative degrees, and you take a deep breath when it's really cold and it just like stings all the way through your lungs.
Yeah.
That's what it felt like when I would take deep breaths. And so it was nerve-wracking because it was just something I hadn't felt before. Like, that was not it wasn't shortness of breath. It was this sort of weird pain sensation in my lungs.
Was it sort of similar to like if you run really fast and your throat burns when you try to breathe deeply?
Yeah, especially in cold weather. Yeah, where you're
Yeah.
like huffing and puffing in cold weather, and that really like deep sort of stinging feeling in your
Yeah.
lungs.
And then how, like, one of the reasons I'm talking to you is because you had corona, and I don't know many people who have in my
Mhm.
personal network. But like more significantly, I think, is the fact that you are a doctor and you got it. So can you walk us through what was happening in your career 3-4 weeks ahead of that, and like how your team responded to you being infected?
Yeah, it was, so most of my time is research, like 80% of my time. And then I do quite a bit of ICU work, and then I do clinic a couple times a week. Um, but initially, I don't know, I didn't tell a lot of people, and I don't really know if I have a good reason other than that I was scared and didn't really, like, there wasn't a lot of advice. So I told my boss, and, you know, the nice thing is, you know, one of those things about having privilege is that, he was able to reach out to people at UCSF who knew people who were doing studies in Minnesota, and I got enrolled in a study right away, and they sent me drugs through the mail.
Oh, wow.
All of these like networks that I was able to tap into. And, I had a home pulse ox, so I was able to like monitor my oxygen levels at home. And like, he, the people I did tell were keeping track of the literature as it came out, and we're like, okay, stop taking Advil. It looks like that doesn't seem to be a good idea now. So it was all of this, like, it was a little bit nerve-wracking as well, because like every day something new's coming out, and you're
Yeah.
like, I don't know whether to trust that or not, and how much to take that as gospel truth in my own personal journey, which is a little bit terrifying.
Yeah. Kasha in LA is asking, how far into your symptoms did you decide to get tested? And also Malia's asking, what kind of drugs were you given for the test group?
Yeah, so I think my symptoms started on like a Thursday, and then as soon as I spiked a fever on Saturday, like a true fever to 39.4 Celsius, I was like almost certain I had it at that point, just because it was all of the right symptoms. At that point, I was allowed to get tested because I was a health worker. And in the city, they were only testing health workers and other people. So again, tapped into a network. Like, I know the doctor who's basically in charge of the COVID emergency response for the county, because we worked together in TB clinic, and she was able to get me an appointment to get tested right away. But my husband, who has certainly been infected, like, he quarantined at home with me for those 14 days, never had any symptoms, but they wouldn't test him at the time because he didn't have symptoms. So things have changed a lot now. You can get tests for, like in San Francisco, we're testing anyone who's an essential worker who wants to be tested.
Yeah.
And then in terms of Malia's question, I don't know. It was a randomized study. So either I got hydroxychloroquine, which is now very controversial, or I got placebo. And then Gaetan, my husband, also got one or the other. They were different pills. So one of us definitely got the real thing and one of us did not. I don't know who it was.
Yeah. And were you two, like, were either of you proceeding with this experience knowing that you had pre-existing conditions, or are you in a category where you're like, I'm otherwise really healthy, this
Yeah.
shouldn't blow me over, but it could?
Yeah, both of us are relatively healthy, other than like allergies and things like that. So, that's what, that's the thing that people keep saying, like I tell my boss and be like, it'll probably be fine. You're young. You don't have any other health problems. But, it's just scary because there was definitely reports, and we had people in the hospitals all over the city who were young, right? 40 years old, 30 something years old, who were getting intubated, and they had very minimal risk factors, maybe like a little bit of like overweight or something. So it was just like, we still know so little about the disease. Like, we don't understand why people respond so differently. And so that was just scary because, we kind of have an understanding of the natural course now, but like whether or not um, you can get worse so rapidly. And that was the thing that was scary, right? Is like, okay, I just have to be really careful. And my sister would call me every day and check on me, and my mom. Like, it was just like this, you're like trying to rest, but everyone is calling you every day. Like, are you still okay? Are you still okay?
Right. That
Still
makes
okay?
sense. Yeah. So you have to kind of like energetically respond to people. Malia was asking, how did you feel an effect with the medicine that you were given, whether it was placebo or?
I don't know. It's just hard to say. It was, because it lasted so long. Like, some days were better than others, but I don't think there was any dramatic turn at any point, um, until the end, until like day 14, and all of a sudden I was just better. I was
Yeah.
just felt normal again.
So, people listening now and later, Chris is not only a doctor, but specifically a pulmonologist. So the lungs are part of what you've trained to study. Um, I want to hear like what pulmonologists are saying about COVID at this point. Sort of like, how mysterious and fascinating is this virus to you as a pulmonologist?
Yeah, I mean, the other thing to know about pulmonary medicine is, in the United States, we're all double trained in pulmonary medicine, so lungs, and then intensive care, the ICU, critical care. So because of the complexity of ventilators and helping people, breathing for people, we spend at least half of our time in the ICU. And I think initially, obviously it was very scary because it's very young people who are getting very sick, but there's just a lot of like fascinating parts about this, sort of from a medical perspective. For some reason, for instance, a lot of these patients will have oxygen saturation levels before they get intubated down into the 80s, sometimes even 70s, and they don't feel it. Like, they don't look in physical distress, right? Like, normally if we took you and like dropped you off on Mount Everest and you dropped your oxygen levels, you would be short of breath, you would look like you needed some assistance, right? But these people don't. And so there's sort of a funny disconnect between like what clinically they look like and then what the numbers are showing us. And so that has been challenging as we try to figure out, well, how early or late do we put them on a ventilator? Is that better or worse?
Interesting.
Um, I think the other thing that's really fascinating that's slowly coming out is that, for some reason, it's not just the pneumonia, right, which is the part that is killing people, but it's also this propensity for blood clots and for inflammation of the blood vessels. And so there have been a lot of people who are developing blood clots, and then all the complications from blood clots, including strokes and things. And that's not something that's normal with influenza or any other virus. And so it's got this unique combination of factors that we're still working really hard to figure out, because we're not totally sure, what is the best way to approach this. It'll be months to years to figure it out.
Yeah. So you said like you got diagnosed in mid-March and there were 53 or 54 cases at that time. So
Yeah.
that would make you part of this small group of confirmed cases. So
Yeah.
did news outlets reach out to you? Like, were you part of any, did you communicate at all with the others who had also
Mhm.
been diagnosed with this?
No, not at the time when I was really sick,
Yeah.
and also like wanted to get to the other side, because you're just like, okay, so once I started to get
Yeah.
healthy, then, have been more open and vocal about it and talking about it. And at the time, it was a very, like when the DPH called me with my positive test, Gaetan was like listening on the phone, and the way that they talked about it was like they told you just had cancer or something, like because it was so scary because it was so new and there were so few. And so, and of course they're telling you over the phone, they're not going to call you into the office to tell you. So I
Wow.
don't know, it was a lot of like fear initially. So now though, I think that as people are doing better, I feel like I'm more willing to talk about it and sort of share my experience, because I think also sort of reiterating that like I was really sick, like and I felt really sick, and thankfully I didn't have to go to the hospital, but like it was serious,
Yeah.
much worse than anything I've ever had before.
Did you have a point in your trajectory with the virus where you got closest to calling into a hospital?
No, thankfully, I was checking my oxygen levels a couple times a day.
Yeah.
And I would go for walks and sort of like push myself to see if I could get my oxygen levels low, and I couldn't. And so I knew that that was reassuring, I think. But again, that's like my own advantage of being a doctor and knowing what would be the things that would put me in a hospital. I think a lot of people would have gone in just because, you feel terrible.
Yeah.
Yeah.
Yeah. You have a couple questions here. So first, Tal, who's in LA, he goes, I am HLA-B27 positive. Have you heard of any issues with this group?
Yeah, so that is something that we're studying right now. So I joined at least one study at UCSF, which is a combined infectious disease allergy immunology study. And it's trying to figure things out like that. So they took like 15 tubes of blood from me to try to look at like, is it genetic receptor differences between people? Because it seems to cluster in families, but is that just because they're in contact with each other? Or is it because the virus has an easier time accessing cells because you have the right cellular component? So I can't, your specific HLA-B27, I don't think there's any evidence to say people are at more or less risk, but people are studying that. Like, what are the things that might put us in different categories?
Yeah, that's great. Do you think the antibody tests are accurate?
That's a good question. I think so there's a lot of different tests out there, both the antigen test and the antibody test, and they're all a little bit different. They've been getting better over time. One of the big struggles with this was that the CDC test that was initially rolled out was not very accurate. But the antibody test most likely will be relatively accurate. And in its current form, I think people are trusting the results. The problem is we just have no idea what that means, right? Like even myself, I know I have antibodies because I was sick. Like I don't know we still don't know if I can get infected again, right? Like presumably there's some period of time that you're protected, but just like influenza, that may wane in 3 months, 6 months, a year. Or is it like polio, where you get a shot or you get exposed as a kid and then you have antibodies for life? We just don't know. And so I think that's, right now the antibody test is mostly for research purposes, because just trying to understand like who has been exposed, like what is the number, but I don't know if we know how to advise people yet.
Yeah. So you talk about this having happened to you in mid-March. Like, obviously my sister is a colleague of yours, and she and so many of your friends were like so busy, right? How did it feel for you professionally to have to step out of that madness, like, and recover?
Yeah, it was really tough for both my husband and I, because so I was in quarantine for 14 days from my first day of symptoms, and then his quarantine actually started on my last day of symptoms. So he was in quarantine for a full month and not being allowed to go to work. And for me, like that was right when the ICUs were getting really busy and they were asking for a lot of help. Um, and like not being able to jump in is really tough when you know that everyone is sort of doing their part and you're just at home and like barely able to stay awake for 6 hours a
Yeah.
day. Um, it was really tough. And so, now I'm trying to still help out as much as I can, but thankfully San Francisco, we're doing well. Like we only have 4 patients at San Francisco General right now in the ICU, so it's good.
Is that are there a couple hospitals that have COVID patients right now? Is it all the general?
No, all the hospitals have a handful.
Okay.
It's not very many. The spike in San Francisco, the largest number at any single hospital was definitely at San Francisco General, and that's largely because of the population the General serves,
Yeah.
and as well known now that virus is disproportionately affecting people of color, and that's the population at the General.
Yes, and I want to. That's sort of like the second part of what I want to talk about with you. Um, but Kasha asked a good question, which is, are you now more likely to wear masks in your life outside of work?
Well, so, mask wearing is to prevent you infecting somebody else, if that makes sense. It's not to prevent you from getting sick, at least in this the types of masks, the cloth masks. At work, of course, we wear N95s, which protect us from getting sick. Um, but, so I'm wearing a mask mostly to show others, it's a little bit more courteous, but, technically I probably can't get reinfected at this stage. I don't know that for sure, but, you know, so I feel a little bit more comfortable like being around people in some ways. But I wear a mask mostly sort of the, Dr. Fauci method. It's because you should be modeling good behavior to other people. So,
Yeah. As someone who's had it yourself and also who has a professional opinion on this, like I think a lot of people around me say who are just people from the public and citizens, they're like, they debate the likelihood that they've had this virus and just weren't
mhm.
aware of it. And they debate whether to get tested to see if they've had it. What's your stance on that?
um, I mean, again, so I've had a lot of friends reach out in other places that are doing antibody testing. And I think it's fine to know that information. Information is always good. The problem is, again, we don't know what that means, and so I think the danger in it is that you don't want someone to get tested and then make the presumption that that means that they're safe to go out and re-engage and do sort of activities
Yeah.
with that'll put them at risk. So, you know, I'm still staying home. I'm still following the rules, even though I know I have antibodies, just because, again, I don't. Can you imagine if I got sick a second time and then ended up in the hospital? Like, that would be a real
Yeah.
depressing
Yeah.
bummer.
What's your understanding and concern over long-term health impacts of having had the virus?
Personally, or like as a whole group,
I think
or as
both.
a
I mean, is
population?
that something that concerns you on the daily? Like, do you read, about long-term health effects? Do you wonder about it? And then what's like your professional opinion on whether we will see that showing up?
Yeah, I guess I'm a little concerned. I don't. I think that's one of the objectives of this study I enrolled in at UCSF they're following me for 2 years, is to follow up on things like
Wow.
that,
Yeah.
immunologically or neurologically, because there are definitely some people who've had very negative outcomes related to their acute illness. I didn't really have any, and so, I don't have a lot of concern personally for long term. I think from a population level as a researcher, I think something that we're thinking a lot about, I mostly do tuberculosis research, is that how are people avoiding healthcare interactions now, and what is that going to mean 6 months from now, a year from now, 2 years from now? It's
Yeah.
been pretty well published now everywhere in the world and in the country that like ED visits are down, clinic visits are down. So it's not that people are less sick, it's just that people are probably suffering at home, and are going to present later in stages of disease, which is not good for anything.
Yeah. You've mentioned tuberculosis a few times. First with the doctor who runs COVID testing in the county, who you work with at the TB lab. When you compare a disease like tuberculosis to a virus like COVID, where do you think the two stand in relation to each other on a historical timeline?
Well, you know, they're like almost antithesis of one another in some ways, like both incredibly deadly, but TB has been around literally since ancient Egyptians, right? Like we know that it has infected mummies, and it will infect people and take years until they get sick, and then keeps them sick for long periods of time, right? So it's like that's why it's so hard to get rid of, because it just sort of quietly exists in the population. We think 2/3 of the world is infected with it.
Wow.
It kills more people than HIV now. Like it's been around for millennia. It'll probably be around for millennia, but it's adapted to be smart about it, right? I think COVID is sort of the classic epidemic bug where, like Ebola or something, where it gets people very sick and they die, but it I think we still have to figure out whether it's going to be a part of our daily lives from now on. Is it going to be like the seasonal flu, or is it something that like SARS, where it after it's run its course, we won't see it again?
We won't see it again. Yeah. What's your opinion, or just you're waiting for more data?
Yeah, I don't think we know yet. We'll see.
Yeah. Do you know if people who have possibly been reinfected shed enough virus the second time around to infect others?
So we um, we know that some people shed for really long periods of time. And so in China, they'd done some studies and people were up to 21 days still shedding. The question that we don't know is whether or not what they're shedding is infectious. So is it just dead virus that's still in your nose? Or is it virus that could actually infect someone? And so that's why people need to stay at home for pretty long periods of time. But, you know, we don't know, like, could I get reinfected, not get sick, but then be able to spread it to others? That's also a question I think that is open, you know, like, even though I'm not getting sick, could I be spreading it to other people because I have antibodies? We don't know.
Yeah. You talked before about masks, and I think like most people do have that understanding that the N95 is the kind of mask you need to protect you from contracting something. Do you think somebody who has a pre-existing condition should certainly be wearing an N95 out at the grocery store versus a cloth mask?
So N95s are tricky because one, they're only created to be worn for single use, like 8 hours. And then once they get moist, it breaks down just from breathing into them for long periods of time. The other thing is they have to be fit appropriately. So we go through fit testing every year at the hospital, and you can't have any facial hair, which is the other big thing for men. And so most of the time, people, if they're using them, they're probably not going to be using them correctly. And then that's depleting the supply that's available to hospitals. So I think most people would recommend that people don't wear them because they're not going to be that significantly better than other available masks.
Yeah. How about masks when in outdoor spaces and not in close proximity to people? This is Lucas.
Yeah, so NPR had a good story out like a week ago that sort of rated all of these different levels. And, you know, I think in general, like San Francisco is saying it's okay to go to the park as long as you maintain 6 feet apart from one another. You don't have to wear a mask if you're sitting among people that you live with. So like if you're sitting with your spouse or your roommates and then 6 feet away is another group, you don't have to be wearing masks. And I think that's because of the turnover of the air. So if there's a breeze, et cetera, it's going to be pretty hard. The greatest risk is an enclosed space with no ventilation. And that a lot of this, actually, this is why so many TB doctors are involved in helping set things up, is because that's been the long-standing ways you develop TB hospitals, clinics, et cetera, is thinking about the ventilation and how that will prevent people from getting sick.
Interesting. Someone also asked a good question about, because I'm sure many of us loved your example of testing your own oxygen at home after you had confirmed COVID within your system. Is there any way that we as lay people could test our oxygen should we contract it?
Yeah, so anyone can buy, they're on Amazon, because all my patients have oxygen issues.
Yeah.
And if, you know, we're trying to understand how much oxygen they need, you can buy them on Amazon. They're like $15. They're not expensive.
And what would we type into Amazon?
Pulse oximeter.
Okay, pulse oximeter. And any kind of brand is okay, basically? Yeah.
Yeah, and then there is now an app that will use an iPhone. I can't show you because I'm talking to my iPhone, but you put your finger up against the camera and then it turns on the light. Because the way that pulse oximeters work is that it shines infrared light through your bloodstream and it's measuring the oxygen content with the infrared light. And so we tested it here at home So with both the one I had that I had purchased
Yep.
previously, and then the one from the phone, and then talked to a few pulmonary friends, and everyone thinks that's you have to pay for it. I want to say it's like $3 or $5 for the app,
Yeah.
but it's relatively accurate. I would just use fingers that have less callus on them. So typically, like your ring finger is a good one. Your pointer finger and your thumb are not as good because you have a lot of callus on them, and then it's hard to get the light to penetrate into your skin.
Interesting. And do you know like roughly what the app is called?
I think if you put in like pulse oximeter, it's the only
Okay.
one that comes
That's
up.
very cool. That's such a good recommendation. Do you feel like there's anything else that you knew as a doctor when you were treating yourself at home that like could help people a little bit? Was there any like natural remedy you used over the counter
Yeah,
that really helped?
it's a good question. Well, so anytime I get a cold, I put myself and have a fever, because fever is really very unpleasant, as anyone who's had one knows. And so like keeping your fever down really helps you feel better. So with most viruses, I'll put myself on like every 6 hour Tylenol and every 6 hour ibuprofen, and then alternating. So like every 3 hours, you're taking one or the other. And the idea is that helps to sort of control your fever around the clock. With this virus, there's concern that Advil may not be safe, and so I had just done Tylenol. But there's literally no other treatments, and so my sister's a dietitian and works out in Indianapolis, and so she was calling me every day with lots of interesting recommendations. And I was like, so she wanted me to be taking zinc as well as pretty high doses of vitamin C, and I was like, at this point, it can't hurt me by any
Yeah.
means. And so I got some vitamin C tablets and some zinc tablets, and then did a lot of teas. So like
Yeah.
ginger tea and turmeric teas, and it would just make me feel better. But it also like I don't know. I was like, any kind of anti-inflammatory properties I could get from anything, why not?
Yeah. Thank you. Kasha says, can you talk a little bit about cytokine storms? I don't know how to pronounce that. How do you
No,
pronounce that, Chris?
cytokine storm. Yeah.
Okay. I feel like my healthy friends are ignoring the possibility that this could kill them.
Yeah, so that's one of the things. So cytokine storm is not specific to this virus. It's sort of when people are very sick in the ICU, or with cancer or an infection or whatever it may be, cytokines are one of the sort of uh, transmitters that exist in the body of signals. And normally when the body's able to sort of control its own response to an infection or a cancer or something, they do good. But sometimes the body's own defenses get completely overwhelmed, and this, what we call a cytokine storm, sort of just causes massive inflammation and problems with all of your organs, and that's when people get really sick. And so that's the thing that I was talking about earlier, that people can see later in the course around day 10, 11, 12. And we don't really know why it's happening more often with this virus. But that's the thing in the ICU that can make people very unwell, because it sort of results in multi-system organ failure. We don't really have a good way to treat it other than trying to prevent it. So, and that can be anyone. Like, we really don't know why some people it happens and other people it doesn't, unfortunately.
Yeah. What was your opinion of Fauci the whole time? And still,
So, I'm a researcher, so like he is well known in the research community, right? As he's the head of the NIAID, and so it's one of the groups that I apply to for money. So I've known who he is for a long time, not personally, but he's been well respected in the community for a long time. So it's kind of entertaining to watch him become such a like scientific rock star, because that doesn't really happen in our world.
right. Yeah.
You're like, hey, all right. If at least one of us can be like super cool and famous, that's better for all of us, I suppose.
Was he somebody who you had a lot of respect for working with him before he gained all of this recognition and leadership?
I think, so he is very well known in the HIV community. And I think a lot of people have known him from that for decades. And so I think have always been very impressed with his response to that epidemic.
Yeah.
Yeah.
Yeah. Lucas says, not sure if you have expertise in this, but as a doctor, do you have any predictions about if there will be another wave of infections this fall?
I mean, I think everyone's nervous in 2 weeks after all these protests, honestly, because there's a lot of people out in the who are in contact with one another right now. And so I think that, we don't know, but I would suspect until there is, because herd immunity doesn't exist, which is sort of a thing that's thrown around, right? So the idea being if you have enough people who have antibodies, you can't transmit it anymore. It's different for every disease, but it's typically north of 90% of people have to have been infected or been immunized. And we're not going to achieve that ever probably so it's really a vaccine that will change the game. So, I think as people get just, myself included, you start to go crazy at home. And so you start doing more risky things. I think we'll see little pockets flare up all over the country for a long time.
What does your email inbox look like right now?
My email inbox.
Like, are you being flooded with kind of like internal research papers on the topic of COVID from people across the country? A lot of thought exchange.
Yeah. So there's a lot. I mean, everyone who's in research has almost like shifted a little bit to do something within COVID. Here in San Francisco, we're trying to focus a lot on disparities with COVID because it's something we've done for a long time and do well. And we're doing interviews with both COVID people who've been infected and then also their family members to understand, like, if you shelter in place, like if you can't, like what does that mean? If you're one bathroom and 9 people, like how are we helping you as a health system to not get your family members sick? So I think it's been a big shift, but it's also, I just heard this fact the other day. There's like 11,000 publications that have been put out by COVID. And in like the entire time of interstitial lung disease, which has been around for decades, fibrotic scarring lung disease, there's only 7,000 publications. So the problem is that there's so much coming out, but the quality is not necessarily very good. So it's really hard to comb through everything to figure out what is something you'll actually accept as a doctor, as a health system, and change your practice because there's a lot of noise.
Yeah. Kasha asked 2 questions. I want to get to both. She says, sorry to be Debbie Downer. I have Louis Diet syndrome. And I want to punch my healthy friends in the face for acting blasé about this. Yeah. I mean, could you talk a little bit about that? Like people who feel they're healthy, taking action to protect those who have pre-existing conditions.
It's frustrating. I think, as well, it's just like you're going home from the ICU and you saw someone who's the exact same age as someone who's out on the street or taking risks that are too high, and it's very hard to get people to understand their own risk and what that may look like. It's something in the HIV world has struggled with for a long time. How do you get people to understand that they're not special, they're not the exception, like they could easily have a very negative outcome as well. So I feel your pain. It's hard.
She's also asking, are you back at work? If so, how long after the diagnosis did you go back?
Yeah, so I work at several Bay Area hospitals, so I had to like be in communication with the occupational health offices at all of them.
Wow.
But yeah, I'm back at work. So I probably waited 21 days or something from the initiation of symptoms. So, but it's been nice to be back because again, you feel like, it's sort of all hands on deck. So nice to be a set of hands.
So you've mentioned disparities and how disparities have affected and interacted with Corona. I think what's on top of mind for everyone right now is race. So I'd love to hear like what you've observed in those interviews you've done that your team has done with families of different race, backgrounds, and positions in the city dealing with COVID.
Yeah, I think so. UCSF did a fairly has done several studies within the Bay Area. So they had a mass testing campaign in the Mission because the majority of our cases within the city and county of San Francisco were coming from the Mission District. They also did a simultaneous testing up in Bolinas, California, which is like a small tourism fishing village, I guess is the best way to put it. And they identified really high rates of infection within the Mission, and 50 some people who didn't have any symptoms were found through this campaign. The majority of which were Latinx peoples, versus Bolinas, which is a very predominantly white community. They didn't find a single infected person in the entire community. And I think, out east, there's been a lot of focus on its effect of the African American population in San Francisco, just because of our demographics. And initially, the biggest wave hit the Latinx population. And I think, the presumption, there's a lot tied into that. One is just the ability to stay at home and work from home, and then now, as people are losing their jobs, people are congregating more and more people in apartments, and then it's hard to maintain social distancing as people are sort of trying to find a place to live. And now we're expanding that study. So your sister is leading a big campaign next weekend to test the Bayshore neighborhood, where the next sort of out wave has been, which is a traditional African American neighborhood in the city, in the south part of the city.
Yeah.
So,
is it accurate to say that across the country we're seeing higher rates of COVID in Latinx and Black communities?
yeah, I think in every population we've looked at, and that's also been true, I think, at least in the UK, so several non-US cohorts. But I think that, the disturbing thing is not only are people more likely to get infected, but unfortunately, they're more likely to have negative outcomes. And, that is probably, much of that is probably tied to underlying disparities related to, why do Black women die in pregnancy at much higher rates than their counterparts in the United States? It's lack of access to care, it's implicit in structural violence and bias. And so, unfortunately, that's just been occurring over and over again in most cities.
Yeah.
Despite our awareness of it, we're not doing a very good job of intervening.
Yeah. We'll pop in with another question here. Will the hospitals ask staff like you to get retested regularly, even if you are now asymptomatic?
Yeah, so that's a good question. We haven't, so UCSF's current policy is every single patient who gets admitted to the hospital is being tested, whether they have symptoms or not. Staff are asked screening questions every day, and their temperature is taken every day upon walking into the hospital, but we haven't been doing regular testing yet. So that's a good question as to whether that would be the next stage as testing becomes more available.
Yeah.
Not sure.
To return to the other topic, I mean, you are in an interracial marriage. You are processing all of the crazy news within that context. How has the news been hitting you two as a couple and with your families? And like last night, Liz said you sent eulogy to her. She sent it to me.
Yeah.
I watched it. How are you processing all the news, especially in that relationship where you have those two perspectives really strong in the house?
Yeah, it has been a very hard week. We had a call with Gaetan's family last night for like 2 hours on Zoom just to sort of unpack as a family. And I think it's just very, I cannot speak to the experience of my husband or my in-laws, but my mother-in-law and father-in-law both do diversity and inclusion for two different universities out on the East Coast and have been doing this work for decades. It's been sort of the passion of their life. And I think they're just really defeated because they've lived through so many riots, right? Like they were part of the March on Washington for Martin Luther King. They were living in LA at the time of the Rodney King riots, obviously Ferguson a couple of years ago. It's just, I think, for my mother-in-law especially, like, you've worked so hard just to be back at the same place. And so I think was a lot of conversation about like just what do we do moving forward, and I think that's something that nobody knows the answer to, but something to try to think about and plan. And I don't know, it's
Yeah.
depressing. But
Yeah. What do you, how do you see this pandemic and all that it's revealing about race? How do you think that's going to affect the future of medicine?
yeah, I it's a good question, and it's tough because just like race in America, we've known these problems existed for a very long time, but people are not doing things to actually intervene upon them. And I think the same is true in medicine. You know, like we've had good recognition of this for a long time, and people like pockets work really hard, you know, in certain health systems, certain doctors, but you know, as a nation, we're still doing terrible, right? Like our population level statistics are miserable for different racial groups in this country. So I don't know. I think it's all tied together, right? Like either
Yeah.
the healthcare system and the U.S. does it together, or
Yeah. Yeah. One thing I saw, I mean, something that occupied a lot of my morning was, there are a lot of like women owned businesses who, on a standard day in the week, pre-COVID, pre all of this outrage around Black Lives Matter, they would be posting about their businesses and like the products they've worked hard to create and the communities they've worked to build. And sort of the trend this morning is a lot of people sort of saying, I'm going to mute my account. Like I'm taking my voice out of the picture to make room for new voices. And on the one hand, I think that's great. And on the other hand, I think it's potentially, another act of silencing female leadership. Um, for you as a gay male who's faced some level of discrimination in your life, what lessons have you learned from being in that identity about how you can proceed within the topic of race and making things more harmonious?
well, I think yeah, it's something Gaetan and I talk about and think about, you know, and you know, my gay friends have posted a lot about Stonewall and thinking about how, you know, the kickoff of Stonewall was a riot, you know, and that led to the modern gay rights movement, and a lot of success, at least for our community. And so I think there's sort of an increasing, and the fact that that was largely a group of trans and people of color and the Stonewall riots,
Mm-hmm.
and they fought hard. And you know, unfortunately, I think the thing that's frustrating about that is that the people who've probably benefited the most are gay white men, and not necessarily gay people of color and trans people. And so I think that, you know, it's for, you know, and I've seen a lot of my like Filipino friends here in California posting things about this today. Like people of different groups, minority groups, have done a lot historically to help one another, especially people of color, Black people. And so I think now, like, if you're in any of those communities, coming together to sort of support the current movement, you know, and recognizing that you have benefited from people in the past who have been working towards what you have now. And so, but you know, how you do that is the big question. I think that's really hard to answer, but at
Yeah.
least recognizing that you need to be part of it.
Yeah. To go back into the medical system a little bit, would you say this statement is true or false, that the medical system across the US right now is overwhelmed? Is that still the case? Have we handled it? Are we in control in terms of ventilators?
I think it's very place specific. And so, you know, in San Francisco, we're doing fine because we have lots of hospitals. It's the benefit of being in a city, right? But Imperial County, California, which is on the Mexican border, has been reporting that they've been turning people away from the hospital because they've had this wave of sick patients crossing the border and coming up and seeking care. So I think it's very dependent. And unfortunately, the way the health system is organized, you know, even when we were at the height of COVID in the city, like working at a lot of hospitals and seeing, unfortunately, how hospitals may or may not work together well, even in times of crisis, right? So, because everyone's trying to protect their own patient population and their own health workers, that it creates a lot of silos, just like states are doing things that are not necessarily in each other's best interest. I think it's one of the unfortunate truths that COVID has revealed is that Americans are not very good at coming together. We sort of identify the group that we are working for, and it may not be necessarily for the whole, you know.
Wow. It's a really interesting perspective. So we saw, as from the outside looking at health workers, like we saw a combination of, people in real distress, like health workers in real distress, completely overwhelmed. And then we saw like TikTok videos of like health workers united and like banding together during this really important moment. What was the inside perspective as a health worker during the peak of COVID in your city?
I think we were very fortunate in San Francisco because we were some of the first to put in measures to control the virus, and we never really got anywhere near the peak that other cities have seen. And so, we were able to step up and never really had the shortages. So we just published our data from San Francisco General, but our mortality rate was significantly lower than most other places. But we were also able to have a completely COVID ICU with only critical care doctors staffing it and critical care nurses. So people who know how to take care of these sick patients, and so of course we're going to have better outcomes because now you have, people trained to respond in the right way. And so I think that, we were very proud of that, but we didn't have the wave that New York had or other cities. And so we didn't have to deal with treating 50 patients and only one doctor. And so our spirits always remained pretty high. They had little pins made at San Francisco called the COVID swim team, because one of the things that you do in COVID, when really low oxygen levels, you put people on their stomachs. You flip them from their back to their stomach, and you do it a couple times a day to open up the different parts of the lung. But then you also rotate which arm is up. So like right or left arm. So it looks like slow motion swimming, because they're flipping slowly over time. So, it's things like that people were doing to they would just go along and flip every patient every couple of hours. And so,
Yeah. What is keeping you up at night? What is sort of occupying your mental space right now?
I mean, I think this last week is definitely all of the riots and stuff. But it also I think it's going to be really sad if a lot of people get sick from their protesting, right? And it's like people are so at the end of their rope that they're willing to take not only risks of, being assaulted by police officers out in the street while they're protesting or getting tear gas, but what if they get sick, And in my mind, it's people fighting a good fight, and then it's going to disproportionately affect this community even more than it already has. And so it's just sort of a depressing spiral that we might enter. But I don't know, you can't tell people not to do it because it's what they need to do.
Yes. Is your husband also in the medical field?
Yeah, he's a OBGYN.
Yeah. Melias has got to go. So good to hear from you, Chris. Thank you for being an awesome doctor and advocate. Yeah, we're all so grateful to you. Would you get I have a bunch of questions, but one of them is did you get, for instance, small shops in San Francisco contacting you and your teams being like, how can we help? Can we bring you coffee? Was that part of your experience?
Yeah, they did. I think it's all run through so a lot of free dinners were given to the hospital workers and free lunches and stuff, which it was really nice. You know what I mean?
It boosted morale a little bit.
Mm-hmm.
What makes you hopeful when you look at research, when you talk to family members, patients of yours, fellow doctors?
I think the speed at which we're doing this, research is a slow process, and rightfully so, right? You want to get it right. You want to do things correctly. But the speed at which we've been able to very rapidly identify the virus, like run through different drugs to figure out which ones are working, communicate that rapidly, both nationally and globally. So it's very encouraging because, had this happened 20 years ago, it would be much more delayed. The internet, all of these things make it easier to rapidly respond. So, you know, it's things have moved quickly in a positive direction in that sense.
Very good. Well, I really want to thank you for taking the time to do this. This is obviously not in your self-interest. You've, informed a bunch of people by being present to this. Just wishing for your family's strength right now as you go through all the political things. And thank you very much.
Yeah, you're most welcome. Thanks for having me, Marg.
You have one last question. Do you have any days off at the same time as your husband? What are you doing to comfort each other?
That's a good question. He mostly does elective surgeries, so he has been at home quite a bit more than usual because we haven't opened back up. So we're at home a lot together. Yeah, we went for a walk on Friday night and just like got to go cocktails in San Francisco. That was really nice, and it was just nice being out. I think that we're trying to find ways. We're struggling a little with how we interact with social media because I think that we're realizing that it makes it part of your everyday life, like moment to moment all day long, and you never have a moment to step away and like in your home find your own peace space, you know, that sort of like allows you to heal so that you can go back out and fight the fight again. So we're still trying to figure that out with a lot of people, I think. Like, how do we create those barriers so that when we do have to step up and do things, that we have the energy to do it? Because I think that the concern is that it just gets us so down, you don't want to do anything. So.
Yeah. Awesome. What can we do is there anything that we can do to support you or doctors? Any like last words on how we can support you?
I think just, you know, listen to the advice of your local health department. You know what I mean? Like, they're in your best interest. People I know are thinking a lot about it, and they know, I mean, we know, right? It's hard to stay at home. It's hard to do this. But, you know, I think, you know, and just be careful because, you know, it's a serious thing. It's a very, very serious thing. Like, I thankfully was not that sick, but I have seen people die and people really be devastated by this. So please don't be that person, you know.
Nice. I think it's important to keep that message strong, especially with like, the other conversation that's become, rightfully so, like more important this week, the last 2 weeks. We need to keep giving that meaningful statement again and again. So thanks for being that voice today.
Sure. Anytime, Mark.
Okay. Bye. Thank you.
Bye.